very, very white. Just nothing roused her.
This isn't something that was just going to go away.
I didn't know if that meant that Maia was going to die.
I just remember waking up in unbelievable pain.
We were in panic. Finally, it hit me like a ton of bricks that my daughter could die.
Next, 3 medical mysteries that defied the experts. Almost from birth, Maia Cooper suffers from bizarre symptoms, but her doctors have no idea what's really going on inside her body.
I had been with her every waking moment. This was very scary for me.
Then, a simple surgery leaves Jackie Romilly fighting for her life, but no one believes her.
I just remember burning up with fever and in excruciating pain.
And Tim Donovan is a healthy 13-year-old until a routine physical changes his life forever.
I was scared because, what's wrong with me? How did they get there?
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. On May 20th, 1999, Jason and Amy Cooper's first child is born, Maia Ruth Cooper.
We were excited, but a little bit nervous. Couldn't believe actually that we got to take this baby home.
Things were going pretty well the first few days, except Amy and I weren't getting a whole lot of sleep. But I suppose that's normal.
But just 2 weeks later, Maia develops a cough, a persistent cough.
The part that we were worrying about was that she was turning blue when she would cough.
Alarmed, Jason and Amy rush Maia to their local hospital.
They brought us right into the emergency room. She wasn't responding. I believe that's when they alerted the code blue.
I didn't know if that meant that Maia was going to die.
Everything really went quick from there. They explained to us that she was going to have help breathing, that her lungs were full of fluid, which the day before when they took x-rays wasn't the case.
Maia's condition is turning critical quickly, and doctors don't know why. She's immediately helicoptered to a larger hospital with a pediatric intensive care unit.
We went in there, and there was our little baby, just with lots of tubes and monitors, and she was so small.
Seeing your child in that situation really kind of takes you by surprise. I mean, you look at her, you want to hold her, but you're not sure if you can.
Maia is isolated in the pediatric intensive care unit for 3 days as doctors run tests trying to figure out what's causing her life-threatening symptoms.
When the results came back on Monday, she tested positive for pertussis.
Pertussis, or whooping cough, is a highly contagious lung infection that occurs most often in newborns who haven't been vaccinated yet. To the Coopers, the diagnosis is a huge relief. Pertussis is easily treatable with antibiotics, and after 10 days in the hospital, Maia is healthy enough to go home.
Maia really recovered quickly. Things sort of got back to normal.
She eventually started nursing again and did really well. She seemed to be growing.
She was just becoming a little girl. Every day she got bigger and more beautiful and more fun.
For the next 5 months, Maia seems fine. But when Jason and Amy try to introduce baby food into her diet, Maia won't have it.
She was picky, and just didn't eat much. But I thought, well, maybe that's because she was used to breast milk and it tastes so much different.
We tried everything. We tried playing airplane. We tried mixing different things together. We tried force feeding her.
Are we torturing him? Are we torturing him?
They kept figuring, well, she's getting the breast milk and that's giving her what she needs. So we weren't very concerned about it.
But as she grows, Maia continues to be a fussy eater, sticking almost exclusively to crackers, juice, and fruits. Then, in February 2001, Maia is 21 months old, when something disturbing happens.
She started vomiting, and we thought, well, it's just some kind of cold virus thing.
The vomiting was so persistent and so violent seems like the wrong word, but it was hard.
Their pediatrician suspects that Maia has a virus and tells them not to worry. As long as she stays hydrated, she'll get over it in a few days. And eventually she does.
We were kind of relieved, actually, that she stopped vomiting and we started introducing foods again. She seemed to be fine. And we went on with our normal lives.
But 11 months later, the vomiting episodes return. And this time, Maia isn't recovering quickly.
She really started to get listless and just wiped out.
She had stopped talking at all. She'd kind of a little bit look at us, but she just seemed kind of spacey.
The Coopers are terrified, and they rush 3-year-old Maia to the emergency room.
They decided to test her urine. I remember them coming back right away and telling us the lab had found a high white blood cell count, which meant she had some kind of infection.
Maia is admitted to the hospital, and test results reveal that she has an acute urinary tract infection. Doctors start her on antibiotics immediately. But they are still puzzled. Even an infection as bad as this shouldn't cause vomiting and lethargy. After 2 days in the hospital, they still have no answers. But by then, Maia has improved, so they decide to send her home.
We thought, hopefully we won't have to be back in a hospital again. We were very excited.
But then, a few weeks later, Jason and Amy notice another strange thing about their daughter.
Maya's hair always seemed to break off, or we didn't know if it wasn't growing or if it was breaking off. It just wasn't getting longer, and we were concerned that maybe there was something else wrong with it.
The Coopers bring Maia to see a dermatologist, and what he tells them is extremely disturbing. He diagnoses Maia with trichotillomania, a psychological disorder in which the patient pulls out their own hair.
And this, I really had a hard time believing, because I have never seen her pull out her hair. I just kept in the back of my mind thinking, I just don't like this answer. There's got to be something more to it. Maybe if she ate more of something in her body, or maybe she needs to take vitamins.
But the fragile hair isn't the only thing that has Amy and Jason worried at this point.
Physically, Maia was doing things later than most children. Crawling, walking. As she got older, though, some more things that just didn't seem to click. She wasn't jumping like most kids.
It was about the time we were thinking, oh, we wish she was potty trained. And one of the things that I had read about is that a child needs to be able to remove their clothing so that they can actually go to the bathroom. And she still wasn't able to do that.
And I thought, she's never going to get this. And I admit, at that time, I seriously started to wonder if maybe there was some mental delay.